This week I watched the video on YouTube, Transgender Healthcare Horror Stories, and as a cisgender woman who isn't so educated on the topic, I really wanted to watch this video and get different perspectives as I've had personal conversations with transgender friends on their experiences with the healthcare industry, but that's only a few, so I thought it would be really informative to watch this video to get a more wider perspective on the topic. So the video opens with several transgender individuals introducing themselves and the statistic that only 8% of Americans are associated with a transgender individual pops up on the screen. I think that's really surprising, as I believe that slowly that percentage will probably grow over time, and that younger generations will become more accepting, and that transgender individuals will become more comfortable and with coming out. Another statistic given is that 70% of transgender individuals nationwide state that they have experienced discrimination in the healthcare industry. Even several of my own friends that I mentioned before have also faced discrimination even during a simple doctor's appointment. It's common for transgender people to experience discrimination. However, the healthcare industry is the one environment where that there should be no discrimination based on age, gender, or race, as that can even come into play when trying to determine a diagnosis or prescribe medication. That can easily go haywire and perhaps endanger the individual's life. One story within the video that I thought was really interesting was the story of Luke Judes, a trans man who went to the doctor and was complaining of UTI symptoms, and that he gets UTIs very commonly. The doctor dismissed Luke's comments that Luke's anatomy was different from what the doctor was expecting, and the doctor wasn't listening to Luke until Luke showed him himself what his anatomy was, and then the doctor apologized. But I think it's very telling that in many cases doctors don't even listen to what transgender people are saying. All the other stories have a common overlying pattern within the healthcare industry, and that is simply that healthcare professionals are dismissing their transgender patients or simply not respecting them. There's a common pattern of misgendering these patients, despite many of them having gone through the process of changing their pronouns legally on all records. Throughout history, the healthcare industry has a record of dismissing, mistreating, and disrespecting minorities. I believe that healthcare workers must have common standards when in practice that allow them to treat all patients respectively. They should receive every patient and treat their ailments at face value and without any bias, or at least minimize any personal biases. In my opinion, many transgender individuals are experiencing transgender patients aren't experiencing perfect service. However, at least treating their transgender patients without any bias and with respect can minimize the damages that mistreatment can cause.